I'm Julie Bliss. I'm a Senior Nursing Education Advisor here at the NMC, and I'm working with the team to lead this review of nursing and midwifery practice learning. I'm also joined today by Suma. Suma, I'll hand over to you.
Thank you, Julie. Hi, everybody. I'm Suma Das, and I'm a Standards Development Specialist, and I'm working very closely with the team on this review of the nursing and midwifery practice learning. Thank you and welcome.
Thanks, Suma. And also Jackie is with us for this session.
Thank you. I'm delighted to see so many of you have joined us. My name is Jackie Williams and I'm a Senior Midwifery Advisor for Education at the NMC and working closely with Julie on this practice learning review because obviously midwifery is included in this. Welcome.
Thank you very much, Jackie and Suma, and thank you to Simon and Orla who are behind the scenes making sure that all goes smoothly. So it's great to see that people are still joining us. So what we want to do today is we said we would put this webinar on to give you a little bit of a background to the review, to talk about the research that's happening and the next steps, and then we'll give you an opportunity to ask some questions as we go forward. So as is ever with an online meeting, going to start with a little bit of housekeeping. We have muted everybody. It's great to see the numbers are now up to 350 and hopefully more will join us. I'm also very pleased to say that Suma is going to be managing the Q&A function. So if you do have any questions, please do add them into that. And then as we get to the end of this presentation, we'll hopefully have about half an hour for questions at the end, and Suma will help to put your questions together and we'll go through them. We will answer as many questions as we can. I think inevitably there will be some common themes, and thank you for Suma for doing that around that. And what we will also be doing is using the questions from this session and also other questions that have come in order to develop a set of frequently asked questions, which we'll be adding to the Practice Learning Review website for information. It is, we are recording this session and we'll be adding the recording and the slide deck to the website for the Practice Learning Review after the session. If you haven't found that webpage yet, you can find it by going onto the Nursing and Midwifery Council website and looking at the section around how we develop the standards. You'll find that information there. Developing our education requirements. You can switch on the live captioning if you want to, and if you've got any questions or observations afterwards, please do use the Practice Learning Review email address that is on this page, which we are monitoring. So I just wanted to note before we move on to talk about the background that's led to the Practice Learning Review, many of you will be aware of the recent Culture Review report that came out in July. There had been some questions raised about the culture within the NMC, and the independent report from RISE was commissioned and that came out in July. It's quite a difficult read. It does reflect the varied experiences of people within the NMC, and there is comment in there about how that may influence the regulatory work of the Nursing and Midwifery Council. The Executive Board have acknowledged all 36 recommendations, and steps are in place to address those concerns and take action. If you do want to find out more information, there is, if you go onto the Nursing and Midwifery Council webpage and look at the About Us section, the heading on the left-hand side, you'll see that there is a webpage about the independent review that has information on it. So we thought it was really important to acknowledge that before we start. Okay, so let's move on to the Practice Learning Review. So many of you will be aware of the work that was conducted by the professional practice team, with consultation with others externally to the NMC to make changes to the standards that went to Council in January 2023. This was phase 2 of the Future Programme standards. And as a result of that work, there was some changes made around the education requirements to starting programmes of study for nursing and midwifery and nursing associates. Within nursing, there was some changes to the role of simulation, and including the fact that up to 600 hours of practice learning could be delivered through simulation. And in midwifery, there was an amendment, an addition of a new standard to ensure that students got a range of experience of leadership and team working across a range of providers. As part of this work, there was quite a lot of work undertaken to get to this point, and some of that has informed where we are now with the practice learning review. So one of the things that was discussed in that work was looking at the international nursing programmes and looking at practice learning hours. What's interesting, and indeed in January 2023, Council made a commitment to look at practice learning hours. What was interesting that there was a lot of things that influenced the practice learning and nursing programmes across the globe. And this is some work that was some findings that came from work that was undertaken by Harlow Consulting in 2021, which is available on the NMC website. They looked at a number of countries, including the States, the Philippines, Australia and New Zealand, and it was desk-based research with discussions with councils and registration bodies in those organisations. And what they found was that the quality of the learning experience was influenced by a range of things. So it wasn't just about the number of practice learning hours, but about the quality of the experience. So very much about integrating theory and practice. They're not two separate entities, and that will not come as a surprise to anybody who's listening to this discussion now or in the recording. That simulation can complement both theory and practice, and that's one of the things that has come out of the work, and that clinical teaching and learning is also influenced by the instructors and the support that students get during their clinical experience. By focusing on the learning experiences and making sure that it's the best experience possible, then the practice learning can be used to its best advantage. The other things that were found was that graduate programmes, so post-registration programmes, preceptorship, etc., also make a difference to what can be required. There are some differences, of course. So in some countries, it's generalist programmes rather than fields of practice, and so on. And it's really building on that work that we're wanting to take forward the practice learning review. So if we think about the context of the review, we have education standards that require a minimum of a degree level that set out the practice and learning components. We want to be sure that nurses, midwives and nursing associates in the future are able to work within the complexity of care. So it's important that they understand continuity of care. We need to consider population health, social and health inequalities. We need to think about continuity, systems leadership. All of these things are within the proficiencies and the standards. And it's about meeting the healthcare needs going forward that we need to be thinking about. I think it's really important to put this into context. You know, we're talking about a lot of pre-registration nursing, midwifery and nursing associate students. You can see here that last academic year, there were around 116,000 students working towards NMC awards, and of those, approximately 100,000 were pre-registration. These figures are up to August 23. We don't have the figures available yet for the academic year that's just concluding. But it's really important that we're able to ensure that the practice learning for all of these students is of good quality and supporting safe practice for the public, but also for the practitioners supporting the students and for the students as we take that forward. Just to note that all of the standards work together. So we're talking here about practice learning, but all of the standards, whether it's nursing, midwifery or nursing associates, will be in line with the standards framework for nursing and midwifery education and the standards for student supervision and assessment. And then alongside those are the programme standards and the standards of proficiency. And of course, all of this is working around the code, so all underpinned by the code as we take that forward. So we have students who are in practice and who are supported by the practice assessor, the practice supervisor and the academic assessor. And that's really important. So students are supported in their learning to ensure that they're able to maximise those opportunities as we take things forward. The other thing to think about is that, as I've said already, public safety is central to the NMC standards, but that's also for the professionals and the students. And we've talked about theory and practice, but the reality is that they're very much linked together. They're not theory over here and practice over here. They inform each other, and we need to take that into consideration as we take things forwards. So for this review of practice learning, although Council in January 23 made a commitment to look at the practice learning hours, we're looking at the breadth of practice learning. As we saw from that previous international work, it's not possible to just think about the hours without thinking about the context and how practice learning is supported. The core is that we're looking for a positive student learning experience. We want to understand what makes for a positive and effective learning experience. We need to think about the inclusive working and learning environment. We want to think about supported learning and supernumerary status. We know that there has been some discussion of that. And we're also considering the integration of theory and practice. And I think that's important because although we're focusing on practice learning, it's not devoid of the theoretical input as we take that forward. So having gone through the context and thinking about where we're at and how we came to this point, I'm going to hand over to Jackie, who's going to talk a little bit more about the review of practice learning for nursing, midwifery and nursing associates. Thank you, Jackie.
Thanks, Julie. So we had 4 key aims for this review. We were wanting to look at the application of simulated practice learning in nursing programmes, particularly since we are changing our standards over the COVID pandemic and how nursing has now adopted new standards for simulation. But we also were interested in how simulation was used in midwifery programmes. Admittedly, that would be theory context. We also want to understand the approaches which mean that students get the appropriate learning opportunities and, importantly, the appropriate resources to enable them to meet proficiency and their programme outcomes. And we wanted to also know what enabled, but also what inhibited practice learning, importantly across the 4 countries of the UK. And last but not least, we wanted to think about factors linked to equality, diversity, inclusion, and what this meant and how much impact this might have to accessing effective practice learning and how these are managed. Next slide, Julie. We did this in 2 ways, by appointing Nuffield to work with us on this, and we wanted them to undertake this review of international literature looking at what makes practice learning effective in both nursing and midwifery, so that we could understand how countries address practice learning hours and how these compared to UK and what this meant for students achieving their proficiency in programme hours, and importantly, their professional behaviours. We were interestingly in how practice learning is operationalised in the different countries, as well as how proficiency is consolidated pre-registration. And we were also mindful that there were also internship arrangements, and we were interested in those and what the issues and factors were around those. And again, we were interested in terms of what inhibited, but what enabled effective practice learning in a variety of countries. Thank you, Julie. So at the moment, we've been really very much in that discovery phase, aided by Nuffield Trust and the international research. We are mindful about what this might mean for education quality assurance. And we are also doing a review of our approaches to that and how that might impact practice learning. We have also independently done an evaluation of simulated practice learning for nursing, and that is in the sort of final stages of that report being developed, and that in time will be published and will inform all this work. And it's been, what we're now working on is a survey which really wants to capture the innovation that is already happening out there within the current standards that we have. And really to aim to get a mechanism to not just identify where innovation is working, but also how we can share that best practice. Thank you, Jude. So we needed to do this discovery work, and we're far advanced at that. We now have a draft report from Nuffield. We'll be giving feedback, and that report will be published in due course. Ultimately, we will need to send a paper to council so that council will discuss what the next stages are and what were our key lines of inquiry. So this is very much a long stage piece of work, very much looking at it proportionately, but making sure our stakeholders come along this journey with us so that we can actually get consensus about which the direction of travel. Thank you, Julie. We have a governance around the whole review of practice learning project. Really important that we continue to communicate and we engage with as wide a stakeholder group as possible. And I'm in a later slide, we have got a community of interest which you can sign up to, so you'll be able to hear more about this work. But we've had these various work streams, which I've already talked to you about. And all that work then goes to the Internal Practice Learning Project Board. And that ultimately goes to an independent steering group, which includes a wide range of stakeholders, including an independent chair, to look at all this work and the evidence that we've gathered. We additionally have a public advisory group which feeds into these project boards and the steering group, as well as a student advisory group. Ultimately, it will need to go to the executive board of the NMC as well as the council before we know the next step. So hopefully you can see how that governance is wrapped around, and the important thing is that a wide range of stakeholders are involved in every step along the way. Thank you, Julie. So within the independent research that has been happening, I've already mentioned that they've done this rapid literature review, but they've also undertaken public engagement. It's very important with our regulatory function to safeguard the public that they are involved in this, as well as expert interviews. And these have been with NMC registrants, current students, as well as people who work in policy and from a wide range of stakeholders. And that analysis of the existing placement data is currently ongoing to formulate this final report to advise our next work. Within the independent research of the international review, we've also been able to, through Nuffield, conduct a number of expert interviews. And these have been really interesting because a lot of this work is not always documented or published. And particularly where you have got government direction within the countries as to how nursing and midwifery programs should operate, it was really important to understand the nuances of what actually happened where it wasn't in the public domain. And our experts have graciously given their time to speak to Nuffield to give us those insights, and I'm sure that will continue as we can develop the work going forward. Thank you, Julie. Just for those of you who are interested, you can see that the numbers here. So they've been very, very busy, Nuffield Trust, over the 9-month period they've been working with us, and they've held 4 policy workshops, 3 with students. I think these, they've also had registrant focus group, the public engagement, and they've had the 27 expert interviews. And I think what's been really important for us to monitor is that we have the 4-country representation, because we're a 4-country regulator, that we have the diversity of these groups, and very much that we're getting a representative sample of people engaging in this work. And we've tried hard to do that, and we've monitored that as we've gone along. Thank you, Julie. So just so you know that we've got those additional work streams, the evaluation of simulated practice learning is complete. We're just looking at that report, and we anticipate to publish that later this month. The education quality assurance is ongoing, and we anticipate that survey that I mentioned, very much wanting to capture innovative and collaborative practice learning, that's planned for autumn 2024, so later this year. Thank you, Julie. So progress to date, that final report from Nuffield will come in the autumn 2024. We've got to make sure that we get this right, and we're getting clear outcomes and recommendations for our future work. I mentioned our external steering group, which will continue, and that's been ably chaired by the former CNO from Scotland, Professor Alex McMahon, as well as public advisory group continuing to meet, and the student advisory group. And as I say, the whole review needs to be presented to NMC Council. We haven't got a confirmed date as yet, but this must happen before we actually progress the work further. In the slides, which you will receive, you will have the link to the Review of Practice Learning webpage, and also the opportunity to sign up for the community of interest. And if there are any questions or queries after this webinar, we've also got a dedicated email address, practicelearningreview@nmc-uk.org. Contact us for us to respond to any queries. Thank you, Julie. So over to you for any questions, and I'm going to hand over to Suma, who is looking at all the questions to see what the themes are. Thank you.
Thank you. I'm going to read out some of the questions. So thank you so far, so much for the questions so far, and I'm just going to put them to Julie and Jackie. So just to kickstart it all off, I'm going to ask a general question. What have your findings indicated so far regarding factors which enable and inhibit practice learning? So this is just an easy one to start us all off.
You took the words right out of my mouth, Suma. I was just going to say that. Let's start with the easy one. I think it's interesting. There's a lot coming out, and we have a draft report. We don't have any final definitive findings, as it were. But it is interesting that the things that are being discussed are the things that we've already talked about, in a sense. So thinking about the support opportunities for students, how they're managed, the resources. I think what's been interesting, the policy workshops that Jackie talked about, the Nuffield Trust have done those with each of the 4 countries. So Jackie alluded to the fact that we're a 4-country regulator across the UK, and we know there are some differences in the way things are managed and delivered across the 4 countries of the UK. So it's been incredibly helpful to have those 4 individual country workshops to think about that. So I think nothing that's not covered in the literature already, but what will be interesting to see is how that pans out and how we're able to triangulate with the education quality assurance work that's ongoing and the evaluation of simulated practice learning for nursing. Jackie, I don't know if you want to add anything.
No, I agree. It's a bit too early to obviously discuss findings. I think my observation is that countries around the world are facing similar issues around practice learning. And I think that was why it was so important to look at it from an international perspective as well as a national perspective. Thanks, Julie.
Thank you both. They're coming in thick and fast now, so which is great. So thank you. And so going to go straight into one about something specifically. It won't be surprising that simulation has already generated a couple of questions. And so one of the first questions is, why is there a difference between the acceptance of simulation hours in nursing versus midwifery? So another easy question to start our discussion around simulation. So over to you both.
Shall I start off just to give a bit of a historical perspective?
Thank you.
I think when we did the work post us leaving European Union and us no longer having to adhere to the EU directive, we certainly didn't get consensus within midwifery in regards of the direction of travel around simulation. We knew from the work that we did at that time that there was very little evidence, and we also were seeing that the approaches in the countries around the world, and particularly in Europe, were very similar, that midwifery didn't have simulation. Having said that, I think we also had a very strong message that whilst we had left the European Union, that there was still this feeling that they wanted to keep more aligned, to the Europe and also to the rest of the world. So I think that's probably where we were at that time. And those programme standards, although they were updated and the language certainly became more contemporary, we integrated some of the skills within the programme standards rather than putting them as appendices. They very much aligned to the EU directive, so anybody who could actually see that visually. I think it was important for us to review that, and I think this report from Nuffield will help us to see where things are. But I suppose it's worth saying that simulation is used extensively within midwifery, particularly within the theoretical space, particularly for hard to achieve proficiencies. But this feeling about this holistic nature of student midwives working with women and families came out loud and clear. But as I say, this is where this review is going to be really interesting, particularly looking at the international literature again. Over to you, Julie, in case there's anything you wanted to add.
Thanks, Jackie. No, I was just going to start by saying what you've just said about the fact that simulation is used in nursing and midwifery. And used with good effect. The difference is that it doesn't contribute in midwifery to practice learning hours. But it is about looking at what comes out of this report, what we find from the evaluation of simulated practice learning report that we hope will be published this month. The evaluation of simulated practice learning has come out of the work. There were, I think, 19 universities that chose to deliver up to 600 hours of simulated practice learning as part of the recovery standards following COVID, and that's now been integrated into the standards for pre-registration nursing. So those universities have been reporting I think quarterly for 2 years, and the evaluation puts that together. So although that's work that's been ongoing and hasn't started for the practice learning review, it's really important work that will inform the recommendations that go to council for next steps. Thank you. Thanks, Suma.
Thank you. And just staying with simulation, do you, I mean, this is going to be a hot question, and I think everybody's quite keen, especially when we announce that we're doing a review, and that kind of elicits kind of that kind of thinking. So do we anticipate any changes to guidance around simulation hours, and how soon can you expect any changes to be implemented? Thank you.
Thanks. So will there be any changes? We need to see what comes out of this discovery work and what the recommendations are that go to council. In relation to the timeline for changes, that it's not likely to be imminent, in the sense that the NMC has a process for looking at the evidence. So this is the discovery phase. We'll go to council with recommendations for key lines of inquiry. If it's felt that there might be some changes that would be beneficial as a result of this discovery work, then there would need to be a consultation and further work in relation to that. So it's not something that's going to happen before Christmas, for sure. Suma, I don't know if you want to add a little bit more about the processes of standards development with your expertise. I know you're here to orchestrate the questions, but that would be really helpful if you wouldn't mind.
Sure, absolutely. I mean, as you said, rightly so, we are in this discovery phase, and so we're waiting to see what the evidence tell us, and based on that evidence we will be making recommendations to council. And then if a recommendation does include to undertake a revisiting of our standards, our programme standards specifically, this will then be looked into the grand process that we have for standards development. So we work on a cycle, on a 5-year cycle, and just being mindful that our most recent education standards are still recent. And so we did need a time to ensure that they are being embedded and they are delivering in our outcomes. But where does this additional evidence inform that future development? And we will need to do a moment of kind of measuring the impact of our new education standards, and the evidence that we gain from this particular work will be part of that recommendation. So I hope I know I've kind of skirted around these, without trying to be specific, but there is that kind of step-by-step approach that we need to take. So the evidence that we are gathering will not just be sat on the shelf. It will be kind of used to inform future work. And that's probably as much as we can say right now. Julie and Jackie.
Could I just add something?
Of course.
I mean, I'm really excited about this work that we're going to be doing this autumn, because I think by gaining information about where there is this innovation, and then having a mechanism which we can disseminate that maybe could be really helpful to program developers, where they may be facing challenges, or they're maybe wanting to develop some of their program aspects, and that can be done within the current standards. And it wouldn't mean change. So I think in a way, yes, absolutely, this work needs to go on, but that does take time. And processes to go through, but there may be some real opportunities coming out around this autumn work where we're going to be asking for this examples of innovation. So I'm really excited about that.
Thanks, Jackie.
Julie, did you want to add anything further?
I was going to say, I think that's a really helpful reminder. And I think what I would do is I'd just say to people, it's great that there's all this interest, but if you haven't already signed up for the community of interest, please do, because as well as using that to keep people informed as what's happening, we'll also be using that to send out information so that you can become involved in the work as we take it forward, which I think is really exciting. So thank you. Thanks, Suma. Next question, please.
Yeah, just bear with, because they are coming in thick and fast. So
which is great,
which is fantastic. And just to be kind of assure everybody that if we're unable to answer every single question, as Julie said at the very beginning, we will be using these questions as a template to develop the FAQs. So please don't be deterred from asking a question, and if they're not answered, they will be. We'll find the other avenues to do so. So I suppose just going into some of the kind of other areas, and specifically around practice hours, do we anticipate that there'll be a reduction in clinical practice hours? And if so, how do you anticipate increasing the quality of the remaining education and learning opportunities? Another easy question for you both.
Yeah, I think that's the nub of it. I think in that sentence, whoever it is has summed up the challenge, really. We don't know, because this is the discovery phase. We don't know what might come out of it. We will in the next few months as we go to council and we look at the final report and we look at all the other things that have come in. I think we talked about at the beginning the importance of the quality of the learning experience. So it's not just about the hours. And I think that's one of the things that we really need to spend some time looking at and testing out. And it may be that those kinds of things are what come out of the key lines of inquiries for the next step. So there may be changes, there may not. And I appreciate how frustrating that is. Only 18 months, 2 years ago, I would have been sat where you are now, asking those questions. But we need to be mindful of what the evidence says and taking that forward. So we will be looking at all options, I guess, is the response. Jackie, do you want to add anything?
Yeah, I think for midwifery, the standards of proficiency that were published in 2019 was a great departure from previous. And I know the LMEs tell me about the challenge that perhaps student midwives facing, and whether a minimum 3-year programme is the right number, and whether there needs to be a sort of a different approach. So I think it's more for me than just the hours. It's about that whole holistic view of practice learning. I think, and between nursing and midwifery, there are some absolute similarities where there may be also some differences that we also need to consider. I think just to reassure people, based on what Suma was saying, if there were any changes in whatever form to any of our standards, there would be a lead-in time, and particularly the AEIs with their practice learning partners would have plenty of notice. This isn't something that would ever be able to be done quickly, and then you'd have to respond quickly. So, and in a way, we want to take you on that journey to make sure we make some of those right decisions. But I think we are being very clear that this is more than the hours. We need to look at it in the round, although obviously the hours is a feature of this. Thanks, Suma.
Thank you. All right, so I'm just going to start going through some of the other questions, and we have lots. So this is specifically about students. And it's asking specifically about our stance. What is the NMC stance on student self-directed learning, home-based, being included in practice hours. So this is quite specific, but very student focused.
Thanks, Suma. So I guess what we would need to say is that for practice learning to be part of the programme, it needs to be in line with the standards. So it needs to be in line with the standards for student supervision and assessment, as well as the programme standards and the proficiencies. So I guess that would be my thought. So working at home, how does that link? I can't see it myself, but I might have missed something here in relation to that. There is an opportunity for students to use reflection, and we know that there has been some discussion and some work around that. And I know that certainly universities and others have been looking at that over the summer. So this is about the practice learning review and what we're looking for in the next steps in going forwards. I'm not sure that I've answered your question. But I think it's really important. I was just about to ask you, Jackie, if you wanted to add some pearls of wisdom.
We have got some piece. We do know that this is an issue, and we have received a number of queries from students and others about this. So we are I can't give you an exact date, but we are nearing completion some work on 3 key policy papers. And I think that may address some of these, because we're trying to provide some real clarity around perhaps reflection, as well as things like breaks and whatever. So as soon as those are finalised, and we're trying to, get them finalised, we'll make sure that this is widely advertised so people can have it, and we'll continue to obviously respond to any individual queries that come in. And I think the only thing, obviously I don't know the individual who is raising that question, but if it would be helpful to have an individual response, do email in, because maybe that there might be things to explore. And if it was a student, for example, that could be helpful, and it may be that also those discussions need to be taken up with the AEI. But I don't know who's asked the question, Suma, but do come back to us if we haven't responded to be helpful.
Yeah, I think what that shows is how that interface between the education quality assurance and current programme delivery and the programme review is so important. So please do get back to us afterwards. Thanks, Suma.
I smile because my next question is going to be about quality assurance. So that's a really nice kind of link to that question. So how will the NMC education QA and practice learning evaluation dovetail or align with the work undertaken regarding workforce training and education, NHSE, and equivalents in the other countries?
Yeah, great question, and it's something that we are constantly working on. I would say, as an organisation, not just for the practice learning review, but generally. So, from the point of view of the practice learning review, I've talked about the policy workshops that were done for each of the 4 countries. We've also taken steps to make sure that we've got good representation from the 4 countries. So the independent steering group has got representation from the 4 countries, from the chief nursing officers and the midwifery officers and various other organisations. The student advisory group, we've made sure that we've got nursing and midwifery students from all of the 4 countries and nursing associate students from England. Also direct entry and apprenticeship routes where appropriate. So we are looking at that. And really all of this is about supporting the future workforce. It's not done in isolation. But as you all know, I'm not telling you something you don't know, it's the complex and complicated arena. So we are working together and having those discussions and conversations. Jackie, do you want to add anything?
No, I think it might be worth, for those of you maybe not aware, that we now have our new quality assurance independent partner in QAA. There will be some broadly, the process is very similar for the AEIs, but there will also be some distinct changes in terms of how they would want to quality assure programs and our relationship with them. So that may be helpful to those who might be involved in quality assurance specifically of the programs.
Thank you. I'm just going to now ask a question around stakeholder involvement. So how will we ensure stakeholder involvement is representative of a diverse population?
Good question. And I think, diversity and inclusion is core throughout the practice learning review. So it's and has been since its inception, I would say. So we've worked really hard to try and ensure that the diversity of the register is represented, but also the populations that we're working with, that registrants and students are working with. Within the NMC, we have the public advisory group, and we've had some really great support from the public engagement team to make sure that we are able to get that breadth of diversity included in the discussions and in the public engagement. We've also, diversity means many things. So we've also taken efforts to make sure that the 4 fields of nursing are included, including learning disabilities, as well as mental health, children and adult nursing, and so on. So I think it would be fair to say that Nuffield have used purposeful sampling to try and ensure that we have that diversity included. But it's also about thinking about the diversity of practice learning. So it's not just the NHS, it's not just hospitals, it's community, it's independent providers, social care, a whole range of things. So on the occasions we have met with Nuffield, and Jackie and I and others in the team have met with them every week to discuss the work, when they've asked us what we've been interested in, I think we've not necessarily been overly helpful, because we've said everything to do with practice learning and thinking about that diversity. So we need to be careful that we don't inadvertently become NHS or hospital focused, but think about that range of opportunities. Because if pre-registration midwifery, nursing and nursing associate students don't see the experience and have that exposure to the journey of individuals using health and social care, they won't think about that as a future, those areas as a future employer.
And just add to that, I suppose the crux of the question was about how we engage with diverse population, and we have those various avenues that you've outlined, but we're always looking to find other opportunities, other ways of engaging. So if there are any suggestions of how to engage with across that diverse population, then please do share that with us today, or even email us. And so that's an ongoing area, because one approach isn't a continued approach, it's always evolving and changing. So please do share examples from your own practice that we can adopt. So
Suma, can I just add
of course,
a little bit about the student advisory group, of course, because it was important that we get diversity within that group.
Yes.
And I'm delighted to be co-chairing that with a student nurse co-chair. Obviously those students will move through their program and even become registered, and that will change. We maybe have to evolve that membership of that group, but I think that is a really substantial departure, because as you all know, we don't it's the universities that enroll the students. We other than obviously within their programs and the quality assurance, it isn't until they join our register we have direct contact with them. And I think that is a real change in and a departure from what we've done, how we've done things previously. We've absolutely engaged with students, but I think having an actual advisory group is really its strength, and I would like to see that might even continue beyond the project. So I think that's been really important to make sure that we hear that voice of people who are experiencing our programs at the moment, and indeed practice learning. Thanks, Suma.
Great, thank you. I've got some specific questions about the research itself that we're undertaking and through the discovery phase. So I'm just going to ask 2 questions at the same time, if that's okay. So, and this is a fairly straightforward. Will the initial key findings from the various work streams be shared as they're reported? So, for example, the Nuffield report. So that's one question. And will there be any research into the difference in direct entry and apprenticeship students and the disparity around practice learning placements in terms of access to external placements?
I'll start, and then Jackie, you can fill in any bits I might miss. So yes, the work will be published. So we have a draft report from Nuffield, for example. That's we're looking at that for accuracy, can I just say, because this is an independent piece of research. So we're not looking at it from, how do we want to make any changes? We're looking at it from that accuracy point of view. The research will go to council. And will be published as part of the council papers, so that will be in the public domain. Likewise, the evaluation of simulated practice learning that we've been talking about, that's part of the education QA business as usual, and that will be published, if not by the end of this month, certainly early next month. I think the other question was around apprenticeship and direct access students and the opportunities to access placements. So we have, in our discussions with Nuffield, asked them to ask about that when they've done the student focus groups and various other things that they've been doing and looking in the literature, and also in the policy workshops. Now, obviously the apprenticeship is an England thing at the moment, but we are looking at that. So we are making attempts to ensure that we cover all aspects, including the discussions that there have been around the holistic standards, perhaps not being as inclusive as some people might want them to be, around mental health, learning disability, children's nursing and adult nursing. It's really important that the standards are holistic, but we want to know what people's experience is of that. So some of the focus groups for nursing have been field specific in order to try and find that out as well. So that's I think that's the start of an answer to the questions, if I've remembered them correctly. And I'm going to hand over to you, Jackie, if you want to add anything.
No, I don't think so. Just to reiterate that, yes, we do publish these reports, but they have to be published at a point in time, particularly where things have to go to council. As Julie says, when you've got business as usual, like the evaluation and simulation, that's different from when we're actually working independently. And I think that's the advantages of joining our community of interest, because then you'll get to know promptly when any of these reports are available to you. Thanks, Suma.
And this is not a question, but it's a comment. It's a nice comment. So I just wanted to take the opportunity just to share that, to say, one of our participants has said that they wanted to say a huge thank you for recognising the diversity of nursing, and that includes social care and PIVOS. We often get forgotten, and so this just want to say this is exactly what we need to hear from the NMC at this time. So I just wanted to share that.
That's really nice, thank you. And if anybody doesn't know, I think it's private, independent, and voluntary organisations. So yeah,
that's great.
Thanks,
thank you
Suma.
for that.
That's lovely.
And we've had a number of questions around apprenticeships and apprentices. So just kind of any general thing that you can say, because we've had such a variety of questions. So in terms of access to training, to those placements, practice hours, is there anything a little general that we can share with everybody now, if possible? Julie, if I could ask you to start.
Okay, so what I would say is that the programme standards are the same for direct access and for apprenticeship students. So that's an important thing. So everybody who's doing a pre-registration nursing or midwifery degree program is doing a degree program, whether it's an apprenticeship route or a direct access route. So I think that's an important point to start with. We do want to know what works well and what are the challenges. At the moment, we don't have the findings, but that is something that we are very mindful of. So I don't think there's any more that we can add at this point about apprenticeships, although we have asked for this to include the supernumerary status and the protected learning, etc. Protected learning time, rather. So yeah. Jackie, is there anything else to add?
No, I mean, I think this review is absolutely about the experience and how they maybe land with the direct entry courses. This isn't about the pros and cons of which type of entry or funding issues. That's absolutely not for us. But the experience of those students, absolutely, we want to take into account to really get a sort of a sense of what that looks like within practice learning.
And just to share, there is understandably frustration, and then I just wanted to acknowledge this particular one and share that with you both now. And if I could just read that out, that it's not a question as such, but an observation and a frustration. Find scoping placements externally challenging for our apprenticeships, as there is not a tariff payment associated with the placement. And as Julie has said, the kind of financial side of apprenticeships is really out of our hands. But that doesn't mean that we can't acknowledge that there is that tension and there's that frustration. Julie, would you like to say anything to that?
Yeah, no, I completely understand that frustration. I think the other thing is that the tariff is only in England. It's not in the devolved nations, although you don't have the apprenticeship either. So I think that's something. But one of the things that we are mindful of is that, some of this is part of the NMC and the standards and the regulation, but some of it is out with our control. But actually there are things that maybe we need to flag. And so we've talked with the Nuffield Trust about what the recommendations might be that come out of the work and whether they're things for other parties to think about. The Nursing and Midwifery Council, the core role is around regulation, but there's also that work around support and influence. So where we can't necessarily make a difference, we can sort of raise comment in question. And the fact that the external steering group has that representation from a range of key stakeholders, including unions, I think is helpful in relation to that. And we appreciate that it's complicated and it's really hard for students who are on a full-time programme with practice and theory, who also need to be able to survive. So I think we need to consider all of those things.
Absolutely.
So I don't have a magic answer. But
I think but thank you for those words. Just conscious of the time, and so I'm just going to stop now for the questions, but we have captured all the questions that have come through, and like I said, the questions we haven't been able to, we will address them in the FAQ. So if I could hand over to Julie to kind of do the final bits, and also to remind the email address when people would like to join the community of interest. If you could share that again, that'd be great. Over to you, Julie.
You completely flummoxed me, but I will. I'm going to put up, hopefully, IT skills permitting, the slide that's got the details of with the practice learning review email address. No, failed. Okay, close your eyes because I don't want to make you all sick as I trot through. Actually, no, let's do it this way. So the practice learning review email address is there. If you go onto the NMC website and you want to, you can email that and we'll send you the details for the community of interest. Or if you go on to the education tab on the NMC webpage and go to developing our education requirements, you'll find information around the practice learning review and the community of interest. It's been great to see so many of you here. Well, see in inverted commas, there were about 420 plus at one point, which is great. It's really good to know that there's so much enthusiasm for the review of practice learning. And thank you for taking the time out of your day. We will post the slides and the recording, and we will do an FAQ document based on the really helpful discussions. So thank you very much, everybody. I hope the rest of the day goes well.